Today we're going to discuss Protocol 2. Protocol 2 is for your non-radicular cases, whereas Protocol 1 is primarily geared towards disc involvement. Protocol 2 is primarily geared toward reestablishment of motion or function in the facet joints, okay? Reestablishment of physiologic movement within the lumbar spine. So if a patient presents and does not have a radicular component, they can be put into Protocol 2, or as a segue from Protocol 1, once they are 50% improved, they can then go into Protocol 2. So the basic elements of Protocol 2 is the reestablishment of physiologic ranges of movement in flexion, lateral flexion, right and left, circumduction, which is the combination of flexion and lateral flexion. We're going to do that right and left, and extension. So we're basically taking a dysfunctional motor unit or motion segment, functional spinal unit, those are all synonyms, and we're bringing it through ranges of movement to reestablish, break up fixations, and get things moving as they were normally designed to. Okay, so we're going to release the table, and let's say we wanted to do this. We'll just use the fifth lumbar again. Let's get our tiller bar. Okay, so the protocol changes. Now we're going to do 10 2-second pumps, one down and one up, in each designated range of movement. Okay, so again, square yourself to the table, your thighs split the patient's knees, lock your arm, slide off the sacrum onto the L5 spinous, and get your center of gravity over the patient, find the area of elastic resistance, and now we're going to do 10 2-second pumps. This is more fluid. Again, it's designed to reestablish physiologic flexion. So anything that's limiting flexion, any fixations that are inhibiting flexion, we're going to try and break those up. Okay, release the lateral flexion lever, and now we're going to go into lateral flexion movement. Before we do that, we want to preload the segment or bring it to the area of elastic resistance. So we're in flexion at the area of elastic resistance. We're going to do 10 lateral flexion movements to the left. Okay, and then we're going to do 10 lateral flexion movements to the right. Okay, and I know that's abbreviated, but you'll do 10 in each direction. Again, we're then going to go into circumduction. Again, find the area of elastic resistance in flexion. Now we're going to do 10 circumductions to the left. So this is the combination of flexion and lateral flexion. 10 circumductions to the left, and then turn 10 circumductions to the right. Your line of drive remains consistent through all of these, 2/3 I to S, 1/3 P to A. We end with extension, and this is where the line of drive changes from 2/3 I to S, 1/3 P to A, to 2/3 P to A, 1/3 I to S. So what we want to do now is promote reestablishment of extension movement. So we get on the spinous process. We now do a primarily P to A contact or thrust or pressure, and then we're going to bring the spine into extension. Remember, through all of these procedures, always inquire for provocation. Ask the patient, is this increasing your back pain? Is it causing any leg pain? Is there any discomfort involved? If there is, then you will back off or even eliminate any one of those procedures to be tried on another day when the patient has had a little more time to heal and their case has a little bit more time to have progressed. And that is a basic overview of Protocol 2.